Okay, we're gonna get started in a little bit. We're just waiting for others to come in, but we can start momentarily, so we don't want to cut into y'all time. We got to They tell us we got a hard stop at 2:30, so we don't want them to come up here cracking the whip, and we want to give y'all some Q&A.
Should we start?
Go ahead, Joe.
All right. Hi, everyone. Welcome. Good afternoon. I hope you guys enjoyed your lunch because we did. It was delicious. Anyways, thank you for being here today. Today we're going to talk about a topic that's very near and dear, especially to me because this is the work that I do. But it's as we come together as a community, we're planning what's the reintegration for this population, the justice involved population, or as we would refer it in my part of the woods, the reentry population. My name is Joel Aguilar. I'm a reentry specialist, or as we would say, maybe a case manager, a peer support specialist, and also a life coach within the justice involved population. The population that I serve is from the age of 18 to the age of 81. So it's a broad population. Each population has its own challenges and its own barriers, and I hope that today we bring some clarification and in hopes that we can bring a lot of information. So with that introduction, I want to also give my panelists the moment to introduce themselves.
Good afternoon, everybody. My name is Efrat Sharoni, or most people who know me well call me Efty, so let's make this a family day. So I'm Efty. I have been working within the system for 25 years, more focused on youth, but I have worked at Loyola Law School at the Center for Juvenile Law and Policy. I was the director of the Office of Reentry for the City of Los Angeles. And most recently, I was the ombudsperson for the state office, Office of Youth and Community Restoration. I think that I have worked with lawyers for many, many years. I am not a lawyer. I am a social worker by training, and so I think for me, the most important thing is that we really look at the whole individual. And I know you guys are all healthcare, so I'm excited to be with my people. But I think being able to focus on the trauma that this population has experienced in their childhood and the trauma that they've experienced during their incarceration is really important. And with that, I will pass it on to Troy, who I'm very excited to be on a panel with.
Thank you, FT and Joel. I'm Pastor Troy Vaughn. I am a person of lived experience who has been fortunate enough to have people invest in my life to restore equity in my own life. And so I've chosen over the past 30 years, so over 3 decades, to invest back into our community. And I do that now through overseeing a consortium of organizations. I'm the president and CEO of the Los Angeles Regional Reentry Partnership, which is a network of over 900 plus community-based organizations, which I'm a co-founder of. I also oversee another organization I co-founded close to 30 years ago called Christ-Centered Ministries, and we have housing projects and support programs all throughout Los Angeles County. And I also serve as the president and CEO of the Los Angeles Mission, one of the largest missions in the United States. I'm proud to be here today to share with you some of the innovative work that we're doing as it relates to health equity for the criminal justice population, and particularly. And then we're also looking at the nexus points and those things that intersect around that. I think it's important that we leave here with a conversation about how we can come out with tangible things that we can actually do in our community so that we just don't leave with information, but I think what next steps need to be in your local community so that you can be involved with change.
Thank you. Thank you. So just getting down to the questions, I'll ask some questions. And so California, the first question. California is the first state in the nation to have approved Medicaid waiver that allows the state to provide Medi-Cal coverage for eligible individuals and the justice-involved population 90 days prior to their release. From your perspective, what are some of the biggest challenges justice-involved individuals face when reintegrating into the community, particularly around basic needs and health care?
So for me, I think, when we talk about an undocumented population that now has access to care, and those that are already been estranged as well from a reintegration standpoint. We have to start thinking about culture, right? Like we can't just think about how people have been impacted and now all of a sudden we create something that gives them access. Because a lot of our undocumented population particularly already have a lot of trepidation as it relates to systems. And we're going to discover that more than ever now. And so we had some issues about how do we get people signed up prior to release, because there's a manpower issue inside the local institutions. And so what we're doing right now at LARP is partnering with our local health plans and the County of Los Angeles, and particularly Correctional Health, so that we can be the representative organization, because we have so many CBOs underneath our umbrella, so that we can go in and actually create a separate workforce that can come alongside the county, because they cannot handle the influx. And so a lot of people are not actually signing up for the benefits that they're eligible for prior to release. So we have to solve that. And the way we do that is through collaboration, and really beginning to make ourselves available to partnership with our local government and particularly institution. The other thing that we saw that's a gap is they're not connecting to the safety net that is created within our communities, and particularly through the federally qualified healthcare centers and the community clinics. And that's because they're staying away. So what we have is an overutilization of our hospital system, and particularly the emergency rooms. And so that was never supposed to be the case. The reason why we have federally qualified healthcare centers and community clinics in our community is to create a release valve from those other hospital systems that we heard earlier today are actually going away. A lot of resources are shrinking, and particularly in BIPOC communities. So we need the safety net more than ever. So we need a communication strategy that's able to communicate to people effectively, and it has to be generational communication. When you're dealing with a population that is culturally sensitive and they have and different things that they are adhering to within that culture, you need communication, and you need people that represents them well in those communities. One of the things that we do well at LARP is that we create community outreach and engagement strategies that actually fit the communities that they go in. And so we believe that each community has its own ecosystem, and so we have regional offices that are set up all throughout LA County that helps to begin to establish resources in that community by that community. I'm a firm believer that people that are mostly impacted oftentimes have their own solutions, but they're furthest from power and resource. And so we exist to be a conduit of those resources and bring them to the community so people can help self-discover what they need to do on their own. And so those are some of the things that I'm seeing right now.
Great question.
Yeah, I mean, I think in terms of the first thing that I really like to lead with is that the justice-involved population is very, very diverse. You know, when I first started as a director at the City of Los Angeles, the Office of Reentry, it was like, well, what do they need? And this population is so diverse. So we have youth. Our youth in LA County are coming out of a very, very chaotic environment. Unfortunately, I'm not sure how familiar you are with LA politics. And so they are coming out of an environment where they have their childhood traumas that probably led to them committing crimes, and then the impacted trauma that they encountered while they were incarcerated. Mm-hmm. So their needs of a 21-year-old young man who may or may not have substance issues, certainly has a lot of complex PTSD, are very, very different than the 71 or the 81-year-old that Joel was talking about earlier, who is a lifer, who has spent 40 years in prison and has no idea how to use a cell phone and no idea how to use technology, or really just like access our different their needs in the community. And then there's also the population that's sort of, we have that's sort of cycling in and out of the jails with a lot of like mental health issues and different things like that. And so I think that a very important thing is that we need to recognize that the justice-involved population is incredibly diverse. And then there's also women, which is a whole nother issue that are not being attended to. And also women are, it's very well known that it's like they are very much forgotten and thrown away. When you go to a male prison on visiting day, there's lines out the door, but women are not, they're forgotten. It's like our community, our society accepts that men make mistakes, but women are thrown away. And so there's many, many layers of it, but I just really implore that people think about the different populations and then employ people within their agencies who are from that population, right? Because what we want to do is if we can get people to come in, we want to make sure we're not re-traumatizing them. We want to be able to use the right language when we're asking them questions. I think it's also very important, like what are the assessments that we're using when somebody is coming into our facilities? When I first got to the mayor's office, they were using this risk assessment tool that was used in prison. And I was like, no, like, we should not be doing this. They're home. They're home. That should be a whole new time. Our goal is, I mean, obviously we do not want people to recidivate, but I really think our goal should be to allow people to return to who they really are meant to be, right? And we want them to be successful and thrive. It's not about just minimizing recidivism. And so when we're doing an assessment, we should really be able to focus on the personalized needs, like an entire biopsychosocial understanding, obviously housing, all of these different issues, but really treating people as an individual and not looking at this as just sort of like, this is the answer for this population.
Great. I think so. What I heard, we need a lot of cross-sector communication. We also need advocacy, because it's important, especially when this is the problem that I see, especially the challenges with basic needs. It's that we do have basic needs that they do provide, but they're only short-term. And for the older population, they need long-term stability, like housing stability. It's like, what's the purpose if we can provide a 6-month, 9-month housing, but then after that, where do they go? So we need something more with more stability, longer. What I notice also with healthcare is that the velocity is not there. So it's true, they come out, and a lot of them already have chronic disease, so they need someone who can coordinate all that for them. And sometimes when they come home, especially to a small CBO, we don't have the resources.
That's right.
And so that's another problem that we see with this population. Okay, let's go to the second question.
I just want to add a little bit to that. One of the things that we're doing to help combat that issue is we're using our mission networks right now to create what we call stabilization centers. And inside the stabilization center is really where we begin to wrap our head around the issues that people are actually facing. And so when you bring people into individualized case management structure, you invite them into a process of transformation. And I think that when we stabilize people, instead of making assumptions that people need this first or they need that first, we need to take time when people are returning home to actually understand what their actual needs are. Because a lot of times what we're doing is and I'm a proponent, let me be clear, I think housing is a right, but I think that some people are not ready to go into housing right away in that type of way. They need services to stabilize them so that they can live effectively in the units. And so because we have accepted the narrative that we just want to put people in a structure without making sure that they can survive in that structure, or really understanding the community they need to be placed in so they can be effective, right? I think when we talk about community and when we talk about equity and when we talk about using the health lens to stabilize community, we do that because we know that if people can be centrally located to primary health care and they can be in that kind of a space in that community, that begins to build a building block that where they can get indoctrinated back to other aspects of our community.
Thank you. All right. Second question. What does trauma-informed approach to reintegration look like for this population? It is important to talk about not just healthcare aspect, but the housing, the food, the nutrition, the support system. All that is important to an individual's ability to reintegrate into their community life.
Yeah, I mean, I think this goes back to a little bit of what I was saying of ensuring that the people who are working with this community have lived experience or from that specific community, because there are issues that we're not understanding, right? There's language barriers, even if everybody is speaking English in the room, because it is, and obviously there are also other language barriers, but I'm saying that I just want it to be really understood, because there's an aversion within our systems for that you don't want to be like labeled as somebody who has mental health needs and different things like that. And so there's really a way that we have to be thoughtful about how we approach it. And it's very hard, right? I can speak for the population. The lifer population. They have the lowest recidivism rates, which is phenomenal. It's great. And so, they in some ways need less, but also they have a tremendous amount of trauma, right? And they are going to come in and they're going to come out, and they need to be supported in a different way. And it needs to be understood like how they are going to relate to a health or a mental health system. And so I think that, to me, it's very important to acknowledge the way that there's nobody who has been in our criminal justice system who has not been traumatized by at least that system, right? Most of the people have been traumatized by multiple systems, foster care systems, our educational systems, our healthcare. So I think that we really need to be thoughtful because we want to engage people and keep them, right? We want to be able to teach them about nutrition. If you think about it, some people have not had to make food or have not had the ability or even the privilege to feed themselves for 40 years, right? And so thinking about like fresh produce, and they haven't had access to fresh produce and vegetables and fresh meats and things like that. So I think there's just so many different components, but I really think that the key is treating each person as an individual and hearing their needs and being able to start where they're at.
Yeah, one of the things that we do at LARP is about maybe 4 years ago, I created what is called a Leadership Academy. And we're into our 6th cohort now because we've been able to expand into multiple counties and jurisdictions. And so incorporating the lived experience voice into decision making is incredibly important for us to understand. And we can't do that unless we equip them, right? It's not just about having an experience of incarceration or being a family member that was impacted by the incarceral stuff. We need to make sure that we're creating processes where we're educating ourselves so that we can be articulate and have a mastery of the issues in community. And so as a person of lived experience myself, and I took it upon myself to go back to school to get an education, to get my law degree, to get my MBA, and my doctorate in theology, not because I was trying to get a lot of degrees on the wall, but I really needed to be invited into rooms where I can begin to articulate my position and not just have to leave with the fact that I had lived experience. I think it's important, but I think it's also important that we educate ourselves fully about what the issues are so that we can create the change that we all seek, right? I think that when we talk about some of the stuff that FD brought up earlier about how women have different impacts, we helped to sponsor a bill that gave women back access to the menstrual products that they needed in partnership with Assemblymember Bryant. And so we wanted to make sure that women understood, like when people are incarcerated, and women in particular, there's certain things that they need access to from a health equity standpoint, but also from a dignity standpoint. I think it's important that we're looking at the totality of a human being, and that when we talk about the services that we're trying to create, even if we're trying to give them access and we think that we're doing right, we need to understand really what really the impact is. And we can only do that if we invite them to the table to have a conversation, and we equip them with all of the information so that they can be rightly informed to help make those changes.
Yeah, I think an important aspect is, like you said, people with lived experience, especially how it looks like in trauma-informed care or a trauma-informed approach to this population. Language is important. And also the space that we create as we welcome the population coming from incarceration. I mean, honestly, it's a population that's been captive for years. And so their relationship with authority, their relationship even with like medical is totally different because the experience that they have in there is traumatizing to them, because usually when they go to the medical doctor in there is usually take water, take aspirins, and you'll be fine. Get some rest. So when they come home, they think it's the same thing. And so they're not the type of, let's just say, of people that would take initiative to, let's go to the doctor, let me get a checkup. So we also need part of this care that we provide for them is to have a conversation with them where give them the autonomy to actually even express what's wrong, because they've never been asked. It's not something that that they probably haven't thought about. It's just that they haven't just been asked, like, what's wrong with, so even advocating for themselves is difficult. So this is why that piece is important as well in trauma-informed care, is language is important, spaces is important, and also how we talk about systems is important for them. And that it's an educational piece for us, I would say.
Yeah, I wanted to add, I was sharing with Joel and FD at lunch about how the evolution of LARP has taken on, right? We had this market growth. I believe that we're in a season where the younger and the older have to yoke up to share in the space together. And a lot of times when you're a visionary to create, and that's what I am, I create programming, I'm a visionary. And I found that when I invited young people, impacted people, people with lived experience, people coming out of college to join my team and give them reins to really be able to be creative in the space, that they had this heart and this passion. And so I had vision, but I didn't have the people to implement the vision. And I think that that's the same thing that we're talking about here, right? Like, all of us in this room want to see change, but we can only realize change when we invite everybody that's in this room to the table and each has mutual level of respect. I think the thing that makes LARP successful is that we don't have real titles. Even though I do for public, when we come to the table, it's really about a creative pool and how can we come together to really create the change. And so everybody has equal voice. And I think that that's what we're going to have to use here in this society right now, is our equal voices to bring about the change. There's a lot of trepidation, I'm sure, in this room and in our society right now by a lot of the things that are happening with our new administration. And this is not a political statement. This is not whether or not you're a Republican or a Democrat. We all need checks and balances in our society, right? That's the rule of law. Like, we need to be able to follow the rule of law for a reason, and because it creates order. And when we don't have that, then we have anarchy and we have crisis, and people get scared. And when we're operating from a standpoint of people that are scared, then we make emotional decisions that are not really based upon the rule of law and effective change. And so we have to begin to come together, I think, and what I want to see come out of a conference like this is what's next? How do we really go back into our neighborhoods and use an equity platform to bring about the change that we need? That's some questions that I have for you guys in the audience. What do you want to see out of this conference, so that when you go back, that you're actually doing something that's real, is tangible, whether it's organizing a network, organizing your community, wanting to make sure that you have clean water, wanting to make sure that whatever it is in your community, that you're doing it in a very effective way so you can bring that health equity to your communities.
Great.
Yeah, I mean, I would say on the same line, it's really, I think that I have worked on legislative issues, and we've had these like grand, victories in criminal justice reform. But then the problem is what happens next? Where's the implementation? And is the way we've written it all, is it making sense? Is it actually implementable? And so you all are the experts in your world. And so I'm interested in hearing from you, what do you need from us? Or what do you think, where are the pitfalls for you, or the areas? Because I want this time to be effective. And I want it to be able to make it so you have like an actual question, like, does this make sense? Does this make sense? Because like great legislation and great ideas and a lot of great talking points doesn't mean that it's actually working its way down to the communities. And it's been very disheartening to me to see that. And so I'm excited for our question answer portion.
Yeah.
If there's anything that I don't know, unless you are you ready? I don't want to. You're the boss.
Are we ready or? Okay.
She got the mic.
All right.
We just threw it out there. You know
All right.
what I mean?
Perfect. Perfect.
We
have a catch.
This is not a norm. Like, I know you guys come. I've been doing conferences for 3 decades, and we always leave 5 minutes left for the Q&A. And I've always felt like, wait a minute, I had a great question. I thought, like, I want to hear it, and so we want to give more time to the engagement with you guys. You guys are experts too. Even though we get to sit up on the panel today for this particular topic, you guys are bringing something to the table. Let's talk about it, and maybe that's going to germinate and bubble up, and the leaders of the conference can take that back. So we got
David Panish, California Health Policy Strategies, and my question is, in the context of CalAIM, I mean, our understanding is that there's all this work that's going on at a county level, but frankly, what I'm hearing from you guys is that you're not at the table. And I don't understand why that is, or have there, and maybe, Troy, maybe you are at the table.
Yeah, I'm
And so
at the table.
how is it working in Los Angeles? How are you participating? What advice do you have for others that should be doing what you're doing? Is your input meaningful? Are they listening? And is this CalAIM thing for the justice involved, is it making a difference that you can see? Is there a light at the end of the tunnel, or a train, or what are we going to see here?
Yeah, so for me, CalAIM is huge, right? Like, and so there's many different pockets that you can do. My lens is actually working with the justice involved population, right? Like, as it relates to CalAIM. And so right now we have a community apparatus that is just getting on the ground. The carceral apparatus is yet to come for a year from now in 2026. I'm just going to be honest with you, because the institutions haven't figured out what that looks like in terms of the engagement process. So you have multiple parties that are at the table. I'm on the community side, also work within the system itself, within the criminal justice system itself, in terms of the jails and the prisons. We have many organizations there, but they're not ready for that piece yet, to be honest with you. But we are at the point where we're engaging in and implementing and putting on the ground the community components of it, which means that we are looking at capacitation work around building up community-based organizations to be able to have access to the CalAIM system. Now, so partnering with Pear Suite, for example, is some of the things that we're looking at across our full network, because some of them are not ready to understand what the billing is. It's complicated to do billing in terms of a community-based organizations, especially if you're smaller, and it takes a lot of apparatus and manpower to get to that place. So having an entity like Pear Suite at this conference is really a plus, because they can come and be like your back office as it relates to the billing side of it, and then it's a safe way that your staff can begin to learn to understand how to take notes accurately, how to make sure that you can bill, how you can get reimbursed for that. And so they already have that level of relationship with the health plan, so that's that. The other thing is taking organizations that desire eventually to be on their own. So a part of the work that we're doing at LARP is we're using entities like a Peer Suite, but also we're coming alongside organizations to say, hey, look, I'm close, but I'm not there yet. So how can I get my MPI? How can I walk in? So those are different levels of capacity building trainings that we're doing with our organizations within our networks. And then, quite frankly, the larger part of our network just wants to be a part of it. They don't want to be really connected to CalAIM in terms of billing, but they want to be supportive. So what we're doing in LA County is we're partnering with we have a Justice Care and Opportunities Department called JCOD. And so right now they have what we call RICMS, right, which is Intensive Case Management Services for the reentry population. And so those organizations underneath JCOD are being prioritized, right? And many of them, most of them, if not all, are a part of LARP. And so they're being prioritized to actually be a part of the work that we're doing in LA County with around CalAIM. The other thing that we're doing, and I think you guys heard from Louise McCarthy that was here earlier in one of the open plenary sessions, is we're going to be partnering with her organization, because they control the healthcare network in terms of the clinics and the FQACs. They're kind of over that connection. And what we want to do is make sure that agencies that we're connecting, that those agencies are in partnership with a healthcare entity, right? So we have a CBO and we have a healthcare entity, and those two networks, so the LARP network and the Community Clinic Association of Los Angeles is coming together to partner with the county and the health plans to create a comprehensive approach of how we can do something effective in terms of utilizing CalAIM. That's what we're doing presently in LA, but we're not doing the jail phase yet. Because the jail is not ready. I mean, I'm being honest. Like, it's a manpower issue. It's budgets. Like, you got to have staff. And so my conversations with the head of correctional health of late is that they're not ready for that. And right now it's looking like 2026. Yes. You got the mic.
She's bringing the mic.
First of all, oh well. Oh, there it goes.
Yeah.
Okay. So yeah, thanks for all those answers, by the way. My name's Ron. I'm at Partnership Health, and that's my job now, is to stand up the Justice Involved initiative for our 24 counties, and I exactly agree. We're really doing what we can to help the counties go live, and they're struggling, and that's an issue. But my question was about another group that tends to, in my observation, be possibly even the most marginalized group in correctional institutions, which is our LGBTQIA plus community, who are members of all of the other
100%.
groups that are there. I have a personal friend from high school who went to prison, and very much against his will, for safety, he had to kind of align with the white supremacist gangs in the prison just for survival. There is no such thing for this community. They have to find their way to fit in, and then at the institutional level, a lot of times their beliefs and stances are just wiped away and just not considered in that environment for what we perceive as safety issues, right? So you asked, what do we want to see, right? I'd like to see more of a specific focus for this group of people as a whole that's interwoven within all the other groups, to somehow help them in some more specific ways.
Interesting, yeah, because that's the actual work that I do. We actually serve the population, the LGBTQ population. We are one of the smallest CBOs in the South Bay area that provides housing for them, and also provides life skills, job readiness. Yeah, so yeah, we will. We can share information, but yeah, you're right. And even trauma-informed care looks different even with that population.
100%.
So even that was a learning curve for us as well. But yeah, there's a lot of gaps when it comes to that population, and you're right. They face tremendous stigma, backlash, and it's just it seems like, I don't know if we're ready or not, but I don't know what the landscape looks like in the future going forward, but it's still a population that we need to serve, and there's a big need there. There's not enough resources for them.
Yeah, I'll say that we're fortunate that we're in California, and we need to understand that and appreciate it, because we get to do a lot of things. Now, that doesn't mean that we're not going to have to figure out how to work with the new administration, because we are. Because from a health equity standpoint, the largest grant-making organization within the United States is HSS. Okay, we need to understand that. And so the philosophies of the administration have just been appointed with their new appointee, the secretary that's just been appointed there. And so Kennedy is going to promote the agendas of the conference.
It hasn't been voted by the whole yet.
Yeah, well, there's no check and balances. So let me just be honest. Let me just be clear. There's no check and balances, so that's an appointment. So now we have to start talking about what does the local, that's what I talk about when we talk about a grand game, and what we see that we need to be actively doing now and not waiting for the hammer to drop. What do you need to be doing now to impact the midterms? What do you need to be doing now to make sure that you're creating a conversation in the state of California, that your voice is being heard in a way that, because you want to make change, right? And if you really want to make change to address every population, you got to be at the table, and you got to be clear and articulate in terms of what the issues are. It's not political to be in the fight. You understand what I'm saying? You got to understand that your voice matters, what you want to bring to the table matters, but you can control at the local level what you want to see and create the ecosystems. One of the things that we did when I first became president and CEO of LA Mission is I challenged our leadership. Now, you're talking about being over a Protestant institution that has been around for close to 90 years, and approaching the board and said, you know what, we need to develop a unique housing for the LGBT community, because when we have them coming into our facility, it's not equipped. The facility that we presently had at the time, it wasn't equipped for us to be able to serve people because the trauma is different, just like we needed a separate women's facility. And I think it's okay to say that, because when people are experiencing homelessness or in reintegration differently, you need to be able to address those unique nuances within those populations. It's not about creating class. It's about understanding the needs of the population and then creating the services that are tailor-made to be actually speaking to that population.
Great. Great answer. Great answer.
Thank you so much. This has all been really helpful. I'm wondering, we're also in a place where the county is not ready for in-reach services to begin. But it sounds like you're so far ahead of where we are with being connected with one another. Like, who's facilitating that? I mean, it sounds like your organization is facilitating that connection, but like, what advice do you have for places where, like, as the county's not ready, I feel like we have to get ready, but we're so siloed with one another, and we don't, I work at a CBO, we don't necessarily have a connection to any of the clinics, and I keep trying to force one, but I'm just one person, and like, do you have advice about how CBOs and clinics and like how we that are on the outside connect with each other to be more prepared so that we can kind of get to where you are? It sounds like it took a long time.
Well, it took years of investing in relationships. Like, this work that we do is about relationships, and that's why I always tell people I'm apolitical, because I work with both sides, right, of the aisle, and I have to do this work. We all have to. And I'm really tired of the line blue and red. I mean, I'm tired of that because I've been doing this work a long time, and so I just decided a long time ago that I was going to be apolitical in my approaches because I'm about the work. And so when you go to people and you create individual relationships, no matter what, because you have to stay centrally focused on the issue that brings you to the table. What makes LARP successful is that we all come from different cultural identity, ideologies. We're all over the place, right? Like, we come from that. But what keeps us at the table, we have Republicans, Democrats, we have people that are straight, people from LGBTQ, we have all that. What keeps us at is that we all believe that the people that are returning to our citizens have a right to return with dignity and care. And so that keeps us at the table. My job as the co-founder and the president and CEO is to keep us coalesced around that reason why we come to the table. And I don't allow us to get off into these splintered conversations around other things, because we don't come to the table with our own agendas. We come together with the agenda and the mission of it. So first, you can start with getting like-minded people like you together to create your voice, right? And then making sure that you are represented at all meetings. Go to the meetings. If you're not in the room, you can't bring the change, right? And don't go in there with, I want to fix it and tear down everything mentality. That never gets you anywhere. You gotta learn the art of collaboration, and you gotta also learn the art of compromise, because you're not gonna always get everything you want all the time. So you have to stay laser focused on the issue. So I would say, find like-minded people like you, create a group, right, in your community, and we have a blueprint at LARP. I will happy to meet with you. You can talk to my staff. We can share what that blueprint looks like. We go to multiple counties and we set up networks in the reentry space for those counties and those communities, so that they can begin to form a coalition of something, so they can start having collective voice. And then once you do that, I bet you when you do that, there's going to be people that come to the table that have existing relationships with probation, the sheriffs, county representatives, and you want to make sure you give them voice to be heard, so you will know what those relationships are. And then you tap into it, right? And so that's how we built over the years. And you gotta not despise the small beginnings. Don't get frustrated because you're starting off small and you don't feel like there's no traction. Sometimes you gotta be the Lone Ranger, at first, because people won't come until you build it. How many times I didn't get not $1 from any foundation for LARP. I remember when I first started programming and I needed staff, I mortgaged my home to pay for my team initially, because I believed in my own mission and vision to really create what we wanted to create. And now fast forward 13 years later, we have a funded network, we are thriving, we're a part of a community, and we're making a difference, and nobody owns it but the people.
So yeah, what I'm hearing is that it's going to take a grassroots coalition,
That's
partnerships,
That's right.
relationships, right? Everyone always says all the resources are in LA, right? We get calls from Orange County, from Riverside, from San Bernardino. They don't have no resources out there. Why is it all located in LA? But you're right. There's something special in LA, and it's the culture. It's the people coming together, grassroots. We want to make a difference. My organization is privately funded. We go through a hard time just trying to get funding, but we're problem solvers. We need housing. There's certain needs that we need. What do? Let's talk to property managers. Let's make a contract. We'll become your property managers for yourself, and we put our population in there. So we have to be creative, but we have to do the work. It takes work.
It takes work.
Yes.
Hello. My name is Elkin Salinas. I work with the Center for Care Innovations, and to your point, one of the things that we're doing, we're convening the managed care plan specifically on CalAIM implementation. We're trying to change the way that health plans, work with one another, and a key aspect of this is how justice involved is different. And I think what I'm hearing from you, Troy, and obviously this panel is you have to work locally, understand who your partners are, but there are these upstream pieces, because I'm hearing, right, I'm taking notes, and we're kind of reflecting back to those that could make it. How do we ensure that we're focused on the problems? Managed care plans are like, we need to figure this out, but it's also saying, who do we need to work with, partner with, and ensure that they have, right, the staff, the funding, et cetera, because to your point, there are so many needs, and right now a lot of managed care plans are reassessing those contracts with their CBOs. They're saying, maybe there are some that we need to support more in terms of capacity building, because justice involved, it is a different community. Like you said, it needs to be tailored, and there are some CBOs that have been working on ECM and community supports that they don't feel comfortable. So I had a question in that kind of commentary is, how might, in addressing these challenges, how do we bring the sheriffs into and the police into being partners who, one, understand justice involved, who understand CalAIM and the resources that exist? And I know St. Cal and Santa Barbara, there was a unique case study where I was like, wow, they knew about the program, meaning CalAIM, for this population. And how do we highlight organizations like LARP so we say, hey, this can be done elsewhere? So I'm curious, it's a big question, but if you can share insights, that'd be great.
I mean, I think that, when I first started working at the mayor's office, I had come from community-based organization, very advocacy, the Center for Juvenile Law and Policy. But I found when I got to City Hall, the people who I connected with the most were law enforcement. And we came from what you would think at that time in my life, opposite sides of the aisle, right? Like, I was the defense expert, I was this. But I think that it's really about, what Troy was saying was relationships and listening. And there are, like-minded people with us who are sheriffs and probation chiefs. And it's about listening to them, but also like honoring that they have an expertise that is different than the community and needs to be heard. And also, if we don't understand the issues that the sheriff is facing in his jail, in why he's unable to, or he or she is unable to get the right amount of health workers in to do the intake at 90 days so we can make sure that the meds are going, you need to I think that the problem that I have seen is that we're coming in angry, and you want to approach people, and I think that generally people like to talk about what they know about, and they want to talk about themselves and their issues. And I think it's about having a listening circle, but being really respectful and understanding that they have a different approach and might use different language. But I think if we don't hear everybody's issues, we're not going to get anywhere. And I think that the reason I was law enforcement ended up, and it really sort of shifted my career, because I really understood, I'm it's not an us versus them. And we will never get anywhere if that's the way we're working, right? We have to all work together. And even the sort of hardest sheriff, at the end of the day, the reason they're there is they want community safety, and they want community safety. I want community safety. What we really want is real community safety for everybody. everyone. And so I think that, you know, what we've all been saying, I think that like listening and really respecting everybody's different types of experience is really the best way to move.
No,
those ways.
I agree, FT. I think, you know, the Jackson 5 wrote a song, one bad apple spoiled a whole bunch. And I used to say, oh, yeah, but only if the bad apple stays in the bunch. And so we have to learn how to not throw the baby out with the bathwater when we're having conversations with people. Because, like, you can, as a black man, there could be a narrative created about black men, right, that can permeate through society. So when you come in contact with people that think all black men are supposed to act like this and they act like that, right? And so all of a sudden we perceive it as a threat, but that's not really necessarily true, because a small population or a component of that, whether you're black, Hispanic, Asian, Caucasian, it doesn't matter, right? It's just that, and law enforcement is like that too, right? And so the reason why I have the chief of police, the mayor, the sheriff on speed dial in my phone, is not because I'm somebody just special. I don't embarrass people in public. I tell the truth to their face in private. I'll do that, but I'm always respectful of the office that they hold. The minute you start to embarrass people in public, they're going to shut down on you, and they're not going to give you an audience, and they don't have to. And I think that we need to understand that if you really are trying to stay centralized and coalesced on the issue that you're trying to solve, you have to build a relationship and trust where people will want to come to you for an opinion because they know you're not going to violate trust. Now, trust is the oxygen that we all breathe in relationship with. Like, if without trust, relationships don't work. It's the thing that gives us life. And that's in anything that you're doing. Just remember that. And so if you want to create a relationship with law enforcement or whoever it is, county or whatever it is, start building the trust. Let them see that you're going to respect the office, even if you have a difference of opinion. And you can do that, but just be respectful in the spaces, and I think that you'll get far.
Hi. Hello. So I'm a student of public health and public policy at Berkeley, and I'm very interested in work around preventing overdose and substance use disorder for folks who are recently leaving incarceration, because it's an incredibly risky time for that group. And I'm really curious from your perspective, not necessarily as like healthcare professionals, but as professionals in the reentry space, what needs to be done to healthcare programs in order to tailor them to this group? I know, FD, mentioned hiring folks from the community, but in addition to having like the right staff on board, how can we not just copy and paste existing health interventions, which for substance use disorder are already only marginally effective most of the time, to make it actually work for this population and build that trust, especially immediately post-release?
Well, we're working on it. I just pulled it up because it's new. We just launched a partnership with UCLA, UC Berkeley, LARP, Charles Drew University, Starting Over, and CalPEP. And there's research that we're doing and piloting with them. Our job is the community interfaces components, that we're bringing people and technology together to address the very thing that you're talking about. How do we utilize technology? And so right now we're creating, which is called, it's a mobile app called MEPS. So Mobile Enhanced Prevention Support, MEPS, MEPS. And so what we hope to come out a couple of years from now with is this tool that would be able to help real-time interventions, right, that can help people that are dealing with coming out of the carceral system with HIV, AIDS, people coming out with hepatitis C, with SUD dependency. So right now, the hope is that we'll be able to create this apparatus that in real time that we can create these level things. So we have multiple phases that we're in right now. So we're in the adaptation phase right now, where we're looking at really coming together and doing the research around MEPS to align with the operational realities of what new partner agencies look like across California. And we're working right now in Riverside County, San Bernardino County, and Alameda County. Now, it's in these phases, right? And then after this, we're going to go into what we call the evaluation phase of it. So the hope is that from here, we'll have this app that can in real time have interfaces for people as they're returning back into society, that we're able to actually map and reduce recidivism, but also reduce harm to what we're seeing. And particularly these communities were chosen because what we're finding is about 1% of every 100,000 people are impacted in these different areas. And so we want to see if we can reduce that impact, right, by creating this technology coupled with a human interface of people with lived experience in community to inform and be involved in the process of the creation of this technology. So it's new, but since you mentioned that you were from UC Berkeley, I wanted to raise it because your people are at the table with us as we're working on it.
I would just also say that I think what's really important is, I mean, I don't even know if it's the right term anymore, but in-reach, right? Like, is that reentry should not start when somebody is released, right? Reentry could start, I'm always like, reentry should start at arrest. I mean, so there should be, as soon as you can get people in there to start working with and talking to people, I think is key for success. And then also, you know, having people that it is a person that they see, right? Relationships, back to relationships and trust. And it was a person that they saw and they knew on the inside, who came and saw them a few times. And so when they come home and everything is scary and whatever is happening, they know that face and they know that. And so I think that having a continuity of a person, or, I mean, ideally it would be a person who could follow them, but an agency or something, so that it shouldn't be like, we shouldn't be thinking about reentry like at release.
100%.
Yeah. And I think the intervention, even like, so we're starting to see something new too, that a lot of the population, the justice involved population that's paroling, they're paroling on Suboxone medication.
That's right.
So like there's a lot of CBOs that don't know how to handle that. So you would need like an Amity, an organization that's big that can equip, that they have a clinic in there that can handle something like that.
Yeah, and we're fortunate in LA County because we have, within our healthcare department, we do a lot of medicated assisted treatment training to CBOs for free, right? And so we come alongside them to make sure that people understand how to have, you know, safety devices. We oversee transitional employment opportunities, and one of the contracts that we have is with LA City, and where we employ formerly incarcerated individuals and people with lived experience to start at an entry-level position, and where we clean the restrooms, right? They clean the restrooms that are for the homeless population. And so we have two merging populations coming together to be of service to one another. But one of the things that came out of that is because they have, you know, naloxone kits, they have this on their person. We have saved so many lives. We got so many accommodations from the city because our staff is saving lives for people that are overdosing in these restrooms, because we educated and informed them about the process and we equipped them with the tools that they needed. And so we can save lives together, and we can make meaningful change if we just educate. So I'm glad you have brought that up, because medicated assisted treatment is important to do. I know we're at time right now. We didn't get the card, but Joel.
Yeah.
I mean, I hope you guys don't mind the shift in this, you know, this panel to involve you guys in it, because we just didn't want to come talking to you guys. So we were intentional about the first phase of our conversation, you know, answering some of the questions that were given to us, but also involving you in the conversation. For me, it's been fruitful.
Yeah, it's been very enjoyable. Also, I think you have, I feel like there's a contact information on the app, so if there's follow-up questions or anything, I'd be happy, you know, to hear from any and all of you.
Yeah, me too.
Again, thank you for having us here. Thank you.